Hello, everyone. Thank you for attending today. We have a special guest speakers today, Bernadette and Jill with the Southwest Iowa Task Force. My name is Annie Randolph. I'm a NEURO-RESOURCE facilitator with the Brain Injury Alliance of Iowa, and we are very excited to have them here today to talk about how stroke is a brain injury. If you're having trouble or difficulty hearing us, please try to call in or use your mic and speakers, whichever one you are not using at this time. If you are using the telephone one or want to use that one, it will provide you with the telephone number to call along with the PIN. Also, we will save time at the end of the session for any questions you might have, so please feel free to use the chat box or the question box at the bottom of your control panel for that at that time. We will be recording this webinar and we'll have it posted on the Brain Injury Alliance of Iowa website in the coming days. No CEUs are provided, but a certificate of attendance along with a survey will be emailed out approximately 1 hour following the session. And without further ado, I will go ahead and switch the screen over to Bernadette and Jill and let them get started. Thank you both again for providing this webinar today. And let me see if I can get this switched over to you guys.
Hi, can you hear us?
I can.
Okay, great.
All right, yeah, I'll go ahead and
show the screen here. We'll just figure this out here and we'll be going. Okay, can you see my slides okay, Annie?
I can, that's perfect. Go right ahead.
Okay, well, thank you so much. I am Bernadette Baca. I'm a clinical nurse specialist at CHI Health, Mercy, in Council Bluffs. And with me is Jill Ferguson. She's the stroke coordinator from Methodist Jenny Edmondson in Council Bluffs also. And together, along with some other very important community partners, we have formed the Southwest Iowa Stroke Task Force, where we are actively looking for opportunities such as this to raise awareness about stroke where we live. In this presentation, we will help you understand more about stroke, its prevention, treatment, and recovery. It will cover stroke risk factors, prevention measures, how to recognize symptoms of a stroke, and how to respond to a stroke. National Stroke Awareness Month takes place in May every year. So happy Stroke Month, everybody. In honor of this special time, National Stroke Association strives to provide everyone with the tools and inspiration to raise public awareness about stroke. Stroke is the third leading cause of death and a leading cause of disability, but many people do not realize how educating themselves and others will help reduce the incidence of stroke. The National Stroke Association encourages everyone to take time during May to spread awareness about how to advocate, educate, and participate. By advocate, we mean influencing public policy and legislature on stroke survivor issues. Educate by spreading the word about stroke awareness. And participate by getting involved and making a difference in the world of stroke. We'd like to give a special thanks to the Brain Injury Alliance of Iowa for allowing us to do this presentation today. You may be wondering how stroke and brain injury are related. In fact, strokes are actually a form of brain injury. Strokes are caused by an interruption of blood flow in the brain. While the brain is not getting enough blood flow, it's being starved of oxygen and other key nutrients it needs. This can result in areas of the brain being injured or even dying as a result of a stroke. Now we'll get into more details about strokes later and what causes them. But our goal today is to reduce your risk of ever having a stroke, help you recognize the signs and symptoms of a stroke so you can get help faster, and know what to do if you or someone you see starts having a stroke. We hope your participation in today's presentation will support you in becoming more stroke smart. We want you to know and understand the 3 R's of stroke, which are reduce, recognize, and respond. Reduce your risk, recognize stroke symptoms, and respond by calling 911 immediately. Let's start by reviewing some little-known stroke facts. Stroke is the leading cause of serious long-term adult disability. So it's the leading cause of adult disability. Over the course of a lifetime, 4 out of every 5 families in the United States will be touched by a stroke. So what does that mean? That means strokes frequently lead to being unable to work while suffering from high medical costs. This can lead to stress not only for the person experiencing a stroke, but to their family members as well. Up to 80% of all strokes are preventable. With education and risk factor management, you can significantly reduce your chances of having a stroke. Every 40 seconds, someone suffers a stroke, and every 4 minutes, someone dies from a stroke. So if you think about it, in our hour-long presentation today, that's about 90 people in the United States that suffer a stroke. And out of that 90, 15 will die. Those are pretty impressive statistics. Now I'd like to share some interesting facts about women in stroke. Stroke kills more than twice as many American women every year as breast cancer. Now, our goal today isn't to say that breast cancer awareness isn't important. It is very important. We just want to give you some insight on how frequently strokes happen, but what little attention strokes receive. A stroke will change your life. Each year, about 55,000 more women than men experience a stroke. Not only that, but more women than men die from a stroke, accounting for more than 67% of all stroke deaths. Overall, lifetime risk of stroke is higher in women than men because life expectancy is higher. Women tend to live longer, so their risk of having a stroke is higher because they do live longer. Also, women who have already suffered one stroke are more likely to get a second stroke than a man. Women suffer greater disability than men. They are more likely to require additional nursing care, like a rehab facility or a nursing home, after a stroke. Not only are these facilities costly, but you and I both know that there's no place like home. Finally, women aged 45 to 54 are experiencing a major increase in strokes. This is mainly due to increased risk factors and a lack of prevention knowledge. So if you know of someone in this age category, get the word out that they need to learn about their risk factors and prevention strategies. African Americans have some alarming statistics as well. The incident rate of stroke in African Americans is almost double that of Caucasians. African Americans suffer more extensive physical impairments, meaning they have more difficulty doing simple things like walking, dressing, or bathing themselves. African Americans are twice as likely to die from a stroke than Caucasians. And unfortunately, African Americans have a higher incidence of risk factors for stroke, which is probably why they have higher death rates and higher incidence rates of having stroke. They have higher rates of high blood pressure or hypertension, diabetes, obesity, more smoking, and sickle cell anemia, which is a blood clotting factor that often runs in African American families. Finally, we have a few facts here about Hispanics and strokes. There are higher incidence of stroke among Mexican Americans than Caucasians. Mexican Americans are at increased risk for stroke at younger ages than Caucasians, so they suffer strokes earlier. And finally, Spanish-speaking Hispanics are less likely to know stroke symptoms than English-speaking Hispanics, African Americans, and Caucasians. So now that we've gone over some of the facts, let's get into the definition of stroke. A stroke occurs when a blood clot blocks a blood vessel or artery, or when a blood vessel breaks, interrupting the blood flow to an area of the brain. When a stroke occurs, it kills brain cells in the area surrounding where the clot or the break occurs. There are two types of stroke. There's ischemic strokes and there's hemorrhagic strokes. An ischemic stroke can occur in two ways and are the most common, accounting for about 87% of all strokes. So the majority of the strokes are ischemic. They can either be embolic or thrombotic. Embolic means that a clot has traveled to the brain from another part of the body, from like their heart, and it's gone to their brain. Thrombotic, a clot actually develops in the artery. This is a picture of the thrombotic right here, where the clot has developed in that artery. Now, the second type of stroke, the hemorrhagic stroke, occurs when a blood vessel in the brain breaks or ruptures. While hemorrhagic stroke is less common, it's far more deadly. The term brain attack is the most descriptive and realistic description of a stroke. It also provides a powerful call to action. A brain attack should warrant the same degree of emergency as a heart attack. After all, your brain is your mind and your body's most vital and delicate organ. Immediate response is crucial because every minute matters. From the time symptoms first become noticeable to the time treatment is received, more brain cells die. In other words, time is brain. The best thing to do is to call 911 for immediate assistance. Treatment is available, and some options are more effective if administered within the first 3 hours after experiencing symptoms. Your chances of walking out of the hospital with little to no disability are greatly improved if you receive the appropriate treatments early. Unfortunately, it takes the average person in the U.S. 12 to 24 hours to get to the hospital after experiencing the first stroke symptoms. This is why it's important that everyone learns how to recognize stroke symptoms and how to respond to strokes immediately. With that, I'm going to turn it over to Jill, who's going to be talking about stroke symptoms.
So, how do you know if you or someone else is having a stroke? There are some common stroke symptoms that we'll go over. Sudden numbness or weakness of your face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination, or a sudden severe headache with no known cause. If you see someone having these symptoms or experience any of these symptoms yourself, call 911 immediately. Appropriate treatment can be more effective if given quickly, and every minute matters. One way to help remember the symptoms of a stroke and what to do is to learn the face, arms, speech test, otherwise known as FAST. F stands for face. You ask the person to smile. Do both sides of the face move equally, which would be normal, or does one side of the face not move at all, which would be abnormal, like the lady's facial drooping in the picture? A is for arm. Ask the person to raise both arms. Do both arms move equally, which is normal, or does one arm drift downward compared to the other, which would be abnormal? S is for speech. Ask the person to speak a simple sentence. Does the person use correct words with no slurring, which would be normal, or do they slur their speech, use inappropriate words, or is unable to speak at all, which would be abnormal? T is for time. It is time to call 911 if you observe any of these symptoms. Call 911 immediately because every minute matters. A TIA, or transient ischemic attack, are a serious warning sign of an impending stroke. A TIA symptoms are the same as a stroke. TIAs are brief episodes of stroke symptoms that resolve within minutes or hours, unlike stroke symptoms, which can last longer. Up to 40% of all persons who experience a TIA will go on to have a full stroke. Some within 2 days of a TIA, 5% of the patients had a stroke. Others in 90 days from a TIA had 10 to 15% have a stroke. Management of the TIAs focus on preventing a future stroke. The cost of stroke. There are direct and indirect costs that are estimated at more than $73 billion a year. The estimated direct and indirect cost of a stroke in 2010 actually was $73.7 billion. The direct costs make up over 60% of this total and include things like the hospital, nursing home, physicians and other health professionals, drugs and medical and home health care. Indirect costs make up nearly 40% of the total and include things like lost productivity and mortality. Many strokes are preventable if you pay attention to the pre-existing medical conditions and control your lifestyle factors such as diet and exercise. The National Stroke Association recommends the following public stroke prevention guidelines. First, know your blood pressure. Have it checked at least annually. If it's elevated, work with your healthcare professional to keep it under control. Having high blood pressure or hypertension increases your stroke risk 4 to 6 times. Find out if you have atrial fibrillation, a type of irregular heartbeat. If left untreated, AFib can increase stroke risk 4 to 6 times. If you smoke, stop. Smoking doubles your stroke risk. If you drink alcohol, do so in moderation. Recent studies have suggested that modest alcohol consumption, up to 2 glasses of wine or the alcohol equivalent, may reduce stroke risk. If you don't drink, don't start. Find out if you have high cholesterol. High cholesterol can indirectly increase your stroke risk by putting people at greater risk of heart disease. Talk to your doctor if your total cholesterol is higher than 200 or if your LDL cholesterol is higher than 100. If you are diabetic, follow your doctor's recommendation carefully to control your diabetes. People with diabetes have a significantly higher stroke risk. This may be related to the circulation problems that diabetes can cause. Incorporate physical activity that you enjoy into your daily routine. Active people tend to have lower cholesterol levels. Regular exercise also seems to slow down or stop clogging of the blood vessels. Enjoy a low sodium, which is salt, or a low fat diet. Too much salt may contribute to a high blood pressure and make it more difficult to control. A diet that is low in fat will likely include vegetables, lean meats such as chicken and fish, low-fat dairy products, and a limited number of eggs. Ask your health professional if you have circulation problems, which increase your risk for stroke. If you do, work with your healthcare professional to control this condition. If you experience any stroke symptoms, seek immediate medical attention by calling 911 because every minute matters. The National Stroke Association recommends that you learn stroke symptoms and how to respond by calling 911. There are two types of treatment for ischemic stroke. Those are the strokes that are caused by clots. The clot buster, or TPA drug, works by dissolving blood clots that are blocking arteries. TPA is an enzyme found naturally in the body. The drug was approved by the Food and Drug Administration in June of 1996 for treatment of stroke, and it can improve outcomes but can only be given within the first 3 hours of symptoms onset. In 2004, the Mercy Retriever was FDA approved, and this is a corkscrew-like device. It is an option for patients who are ineligible for TPA treatment. The device is threaded through a catheter up through the body to a clot in the brain. The clot is then removed, restoring the blood flow to the affected area of the brain. All right. They also have some new embolectomy devices which are specifically designed to remove the thrombus in an acute ischemic stroke. And these devices remove it by aspirating and extracting it. There are also some FDA-approved treatments available for the hemorrhagic stroke, which include a surgical clipping or coiling. A clipping currently is the most common kind of treatment. It involves making an opening in the skull bone and placing a metal clip across the aneurysm to stop the blood from flowing into the brain. And a coiling involves inserting a catheter through the artery in the leg, running it through the body into the brain, and filling in the aneurysm with tiny platinum coils. There's still so much we don't know about how the brain can seemingly repair itself from the functional damage caused by a stroke. But some brain cells may only be temporarily damaged and may resume functioning. In some cases, the brain can relearn what was lost, and sometimes a region of the brain takes over for a region damaged by the stroke. People who have had stroke sometimes experience remarkable and unanticipated recoveries that they can't be explained. General recovery guidelines show that 10% of stroke survivors recover almost completely. 25% recover with minor disabilities. 40% experience moderate to severe disabilities requiring special care. 10% require care within either a skilled care or a long-term care facility, and 15% die shortly after the stroke. Stroke survivors and their families can find workable solutions to most difficult situations by approaching every problem with patience, creativity, and tenacity. So for more information about stroke or stroke awareness, the National Stroke Association can be called toll-free at 1-800-STROKES which is 787-6537, or you can visit them at www.stroke.org. And here's more information about our Southwest Iowa Task Force. And there's the listing for myself and for Bernadette, and we are from Methodist Jenny Evanston and CHI Mercy here in Council Bluffs.
We'll put that up again here at the end, but we did want to show a short video that's from the American Stroke Association. Kind of goes through some body language and the importance of noticing a stroke, and then some visuals on that FAST that Jill was talking about.
Quiet, please. Wait a sec. I'll take one. Oh, yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh, no. Please, please. Please, I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F. Face grouping. A. Arm weakness. S. Speech difficulty. T. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, sudden signs, and spot a stroke fast.
So one of the things we wanted to stress too is that it doesn't have to be all of those symptoms for you having a stroke. Let me go back to the screen here. You don't need to have facial drooping and arm and speech all together. It could just be one symptom that you're having and get immediate treatment. I don't know if anyone you saw on the news, there was a news broadcaster who was young, in her 30s, who recently was doing a story and had problems speaking suddenly. She couldn't get any of the words out, and that was her symptom of a stroke, but she didn't have any facial drooping or any arm weakness. So she got immediate treatment and was able to recover completely, but that's just an example. Even if you have one symptom, to call 911 immediately. And like Jill also said, if you have one of the symptoms but it goes away, you still need to get immediate treatment, because that could mean it was one of those mini strokes, TIAs, that Jill talked about, where it could eventually lead to a more significant stroke. It's more of a warning sign. And then we did have on here the website, www.stroke.org. So we have that pulled up for you to show you some of the resources that are available for stroke if you want to learn more after our presentation today. Of course, they have more information on stroke recovery for people who have experienced stroke, and also those of caregivers and family members, because it does take a toll on the entire family, like I said. There are support groups that are available. There's more information if you're a health care professional and you'd like to give more education to either your facility or your community. You can utilize this resource. It has more information on the different strokes that we talked about, the hemorrhagic, which is the bleeding, and the ischemic, which could be from either the hardening of the arteries or a blood clot, and the mini stroke. It has more information on preventing strokes and changing your lifestyle. information on starting a support group if you can't find one in your area, and just raising more awareness about stroke. There's also ways to give on this site if you would like to make a donation or get further involved in any of the stroke-related issues in your area.
So Bernadette and I, again, we are part of the Southwest Iowa Stroke Task Force. We joined together to make this task force because we realized 60% of our patients coming to CHI Mercy or Methodist Jenny Edmondson did not come in within the first 3 to 4 hours of their symptom onset. So we are not able to give these patients the medications like TPA, which can help to kind of bust that clot, and it helps with recovery and lessen some symptoms. And that's, it was a big deal to us to make sure that people are becoming more aware of signs and symptoms, how it's super important to be getting in right away. I think the education on chest pain and cardiac awareness was getting out there, and people are starting to come in more timely for when they're having a heart attack. But we need to have stroke education be out there the same. People need to come in right away. If you're unable to use your arm, if you're unable to get across what you want to say, you have sudden onset of dizziness, headache, things like anything, any changes neurologically, we need people to come to the emergency room right away so that we can do, a workup. We can do a CAT scan of your head, do some lab work. We can figure out what the cause is. Are you having a TIA, which is a warning stroke, really, or are you having, an actual stroke, so that more people could hopefully receive medications that can help to bust those clots like the TPA.
So that's all we had planned for today.
All right, thank you,
We'll
ladies.
turn this back over to Annie for some additional presentation, and then we'll take some questions.
Thank you, guys.
Thank you. Put up our...
I'm going to switch it back to my screen, and then I'm going to do an overview of the Brain Injury Alliance and who we are and what we do, and then talk a little bit about our main program, our NEURO-RESOURCE Facilitation Program. If I can just get this back. Here we go. Pull this up. Okay. Can you guys see my screen?
Yes, I think so.
Okay, perfect. Like I said, thank you guys again for helping us with information on how stroke is a brain injury. Here at the Brain Injury Alliance of Iowa, our main mission is to help support and advocate for those folks who have brain injuries and their loved ones. Our main program here at the Brain Injury Alliance of Iowa is our NEURO-RESOURCE Facilitation Program. That program helps folks in their communities choose, get, and keep information on services and supports in their communities to help make informed choices and to meet their goals. Everything that we do here is to help inform. There's a lot of information that folks have requested to have after a loved one has received a brain injury to help them make those decisions and to know what their options are. And we try to be that advocacy organization to help them with that. So this is a really good picture of what our facilitation program does. We do our best to connect folks with those resources that they are in need of, whether it be a brain injury support group, a stroke support group, information on a brain injury for their family and their caregivers to have, information about community services that they might be seeking, anything that they are inquiring about. We try to do our best to connect them to those folks and help facilitate any questions or any communication to help break down those barriers of them receiving those services. Also, we help folks navigate coming out of the hospital, discharging, and finding possibly new placement, or coming back home, and what all of that entails. If they're interested in getting signed up for Medicaid or Social Security disability, we can help them with those application processes and get them connected to the right folks. The principles of our program called NERF is that it's individualized, completely individualized to the person who is requesting the services or the information and resources. We're very accessible. We have 3 offices across the state of Iowa. We cover the whole state of Iowa. Our NEURO-RESOURCE facilitation program is regionalized, and there we have 5 what we call NERFs throughout the state of Iowa who cover specific counties. So whichever county you live in, you will be connected to the NERF that covers your county, who knows that area of Iowa best and will be able to get you access to any resources you are requesting in that area. We're holistic, so we look at the whole person, considering anything that they tell us that they are in need of, try to understand as best as we can everything that they are going through, what information they're giving to us, and it's effective and valued. This program has a lot of benefits for Iowans who have received brain injuries and for those caregivers, and we're also there for the professionals. So if you are a professional listening in on this, we are there for you too. So if you have someone who you are working with who has a brain injury, or maybe it's undiagnosed, and you are looking for some additional resources to provide to them on brain injury, we're there for you as well. And we're also participant directed, like I said, very individualized. It's driven by the person who is requesting the resources. They're the ones driving the bus, so we just want to be there to help guide them along the way with information to help them make informed choices. And definitely have to be creative and flexible. The system within which we're working in can be very overwhelming to navigate on your own. So we try to be there to help folks navigate that so they don't feel alone, and so that they feel like they have someone to go to with any questions about brain injury or the systems they're navigating, to help be someone there who is supporting them through that process. So these are just some of the systems that we help folks navigate. We do our best as NERFs and any staff of the Brain Injury Alliance to sit on these folks' meetings that they have, to educate them, to be a part of their conversation, and waving the flag for brain injury and keeping that in the forefront of their mind on how their services also affect folks with brain injury and how that can help someone connect to their services better. So we try to do our best to connect with these folks and stay connected so that we can in turn give any information that we have to our clients that are requesting information or needing help navigating these particular systems. So connecting to the Brain Injury Alliance is very easy. You call our toll-free number and you will connect with our intake specialist, Sam, and she will connect you to the NEURO-RESOURCE facilitator in your area. We have 3 offices in Iowa: Urbandale, Iowa City, and Waterloo. Like I said, however, we do cover the whole state of Iowa. Additional information that maybe you're wanting to look at before you were to give us a call, or maybe even after, can be found on our website. We have a lot of resources on there that we regularly talk to our clients about. So that's also where you'll find this webinar today. It'll be recorded and it'll be put up on our website within the next coming days. Also, you can email us at info@biaia.org. Another way that folks find out about us is through the Iowa Department of Public Health. They send out a registry letter every couple of months to folks who have received medical services for their brain injuries. So we get a lot of calls from that. And then anybody who does call us, we give them a tote bag that we have designed here full of resources for the state of Iowa on brain injury resources, how to help caregivers, information on the Medicaid brain injury waiver, neuropsychological evaluation, support groups, all sorts of good things are in that tote bag. And if you are wanting some additional information that doesn't normally come in our tote bag, we will make sure to specialize that tote bag to fit your needs and give you information that you are specifically looking on or looking for. And then we provide ongoing follow-up. A lot of our clients and our caregivers that we talk to, we do a lot of communication the first couple of days to get them established with the resources that they are needing at that time. And then we provide that ongoing follow-up every couple of weeks, every couple of months, and so on, to follow up and see how things are going. Part of that on that first slide about how we help them connect, but not only just connect, but help them get and keep those services. So we try to stay there as an ongoing support to those folks who are needing additional support, but maybe have forgotten that we're here or are so busy figuring things out that they haven't called us or whatnot. Any reason, we try to make sure that we follow up with them. So that's how you connect to us, and that's a little bit about what we do here at the Brain Injury Alliance. We do have a couple of questions that I want to pose to Bernadette and Jill. The first one, let me first get you guys back on so you're not muted. Okay, you're unmuted now, and I'll go ahead and ask this first question that we have here. Someone says they have a child that has had several strokes. How can I better educate the people around her to understand and watch for signs and symptoms? I hear more than not that children cannot have strokes. Any ideas on pediatric awareness ideas?
This is Jill, and I would educate everybody on FAST. Like looking for some of the subtle cues, the face, the arm, the speech. Are they appearing to be staggering when walking? Like they're dizzy, things like that. That wouldn't be normal. Any of those changes. Again, in kids, it's kind of harder to sometimes notice those things. They're a little bit more resilient, but I would go, when we were on the stroke.org website, they did have some pediatric awareness, some pediatric stuff, so I would start there for some resources, and then get in contact with the National Stroke Association. Pediatric strokes are out there, they're just not as common as an adult stroke.
And when I'm doing any education for anyone about anything, it's always starting off with the whys. First of all, letting them know that it can happen and how very important it is. You could have long-lasting effects from a stroke if it's not caught early, and so it's everyone's responsibility, especially those that are close to that child, like teachers, grandparents, relatives, to get educated and to be hypervigilant, looking for any signs of anything that could be a change. So the whys behind it, knowing the things that can happen, which is anything from reversible things to even, unfortunately, death. And they have to know how very important it is. And if you need them to talk to a healthcare provider to stress the importance, like your physician or a nurse, I'm sure they're more than willing to give their input, or the Brain Injury Alliance as well would serve as a great resource for anybody that you're having barriers with getting that education through to.
I was going to say that as well. Thank you. This is Annie again with the Brain Injury Alliance.
They do a great job, so be a great resource and advocate for anybody that you want to stress the importance of this information to.
Definitely. The next question that we have is it common to experience edema in the affected arm and leg after a stroke, even with elevation?
Yeah, I have seen that before, and that's just because they are weaker, so you're not using the muscles. So you need to keep them elevated, keep exercising. But no, it's not uncommon to have that happen.
Okay, thank you. If anybody else has any other questions, those are the only two that we have at this point. Please feel free to type them in at this time, and we will go ahead and get them answered. We have at least 15 minutes left of time that we are available, that Bernadette and Jill and I are available for questions. So if you have any more, please feel free to type those in the question box. We'll check the chat. And if we don't have any further questions, that is okay. If you know of someone who was unable to watch the webinar today, please let them know that they can watch it at a later date once it gets posted up on our website. And I will also send this webinar to Bernadette and Jill so that they can distribute it as they would like. And if you guys have further questions, feel free to reach out to us, either at the Brain Injury Alliance or to Bernadette and Jill. Like they mentioned before, we are also here for any ongoing support. For that question earlier about the child who had a stroke, we have pediatric tote bags here as well. So we have adult and then pediatric ones that we can send out. And we regularly do help folks who are struggling with that same question about how do I educate my friends and my family about what is going on with my child or with my husband, with these new changes and challenges that they're experiencing after their brain injury. So we do a lot of assistance with kind of helping navigating those initial conversations, providing resources that you could then go through with your friends and your family to help them understand the effects of brain injury, along with stroke. That is also in our tote bag. So feel free to reach out to us or to Bernadette and Jill, or either the website that they referred to earlier, the National Stroke Association website, for further information. No other questions have come in at this time, so I will go ahead and end the webinar. Thank you everybody for attending today, and thank you Bernadette and Jill for being here with us. And like I said, no CEUs will be provided, but we will send out a short survey, a link to a short survey in about an hour to all attendees. So please fill that out if you have time. And please refer to our website for this recorded webinar in the future. Thank you, Bernadette and Jill.
Thank you so much.
Have a good rest of your day. Thank you everyone for attending.
Bye.
Bye.